Once the restriction points for an extremity have been opened, effleurage can then be performed. There are two modalities or directions in which to think about providing effleurage. Classically, it is taught to begin distally and work your way through each finger, medial, lateral, anterior, posterior, into the hand, and working from the hand into the wrist, and then into the forearm. Pulling and pushing fluids as you go. Once you work into the upper portion of the extremity, then that gets into the anterior and posterior axillary folds, which ultimately are going to drain into the thoracic inlet. An alternative to this technique would be to actually start proximally mobilizing fluids closer to the thoracic inlet and then working your way distally. Mechanically, this does make more sense and you may see greater benefit. So that would be done by starting in the shoulder, working through those tissues, anterior and posterior, into the anterior and posterior axillary folds, and then into the upper extremity portion above the elbow, and then again into the forearm. You'll notice less of a buildup of fluid advancing with this technique because the fluid has been pushed into thoracic inlet and gradual amounts are being added instead of starting at the end of the extremity. So those would be ways to do the upper extremity in those two formats. Moving to the lower extremity, classically starting distally and working proximally. Again, starting with the toes, medial, lateral, anterior, and posterior. And then reaching into the metatarsals, tarsals, being sure to focus towards the Achilles tendon where the primary drainage of the foot is, and then once into the lower part of the leg, working that up to the popliteal fossa, and then from the popliteal fossa for the thigh, working anterior, posterior, medial, lateral towards the inguinal ligament region where drainage is. Again, an alternative modality would be to start proximally, in this case closest to the inguinal ligament, and pushing fluids from proximal positions further proximally, and then working your way distally to mobilize fluids to the knee, and then into the lower leg, calf, and to the ankle. And from the ankle, working through the Achilles, dorsal portion of the foot, plantar surface simultaneously, and then finishing with the toes, anterior, posterior, medial, and lateral. So two modalities for mobilizing lymphatic fluid in upper and lower extremities.